Hi guys, this is Professor Elliott. We're going to discuss Chapter 7, Over-the-Counter Medications and Herbal Supplements. So OTC meds, if you see that, that is going to be your over-the-counter medications. These are medications that do not require a prescription. You could go to the gas station, the grocery, obviously the drugstore to get these medications. So look at this list, see if you have ever taken any of these. I'm sure you have. I've taken probably all of them at some point, right? You get an upset stomach, you feel like that indigestion, or your allergies are bad, you have a headache. These medications are available for you. Don't require that doctor's visit, don't require waiting for a prescription. So we'll look here at an over-the-counter drug label. So I just want you to look at this and understand the components, not only for yourself, but to help your patients as well. So we'll see up at the top, drug facts. Active ingredients is listed next. So here we've got what is this drug? You know, what is it? So this is an antihistamine. We've got the uses. So this is this is our indication, right? So our indication is temporarily relieves, so this is not long-term, but it temporarily relieves allergies. So we've got some symptoms of allergies there. We've got warnings, and we'll talk about all of these components when we discuss drugs, but warnings are really are contraindications. So these are glaucoma. Glaucoma is increased intraocular pressure, so pressure in your eyeball. COPD is here, and then benign prostatic hyperplasia, which is a big prostate that leads to decreased urination. Next is an interaction. So ask a doctor or pharmacist before you use this if you're taking tranquilizers or sedatives. And then when using this product, and it lists here some adverse effects. So it can cause drowsiness. You don't want to drink alcohol, because it can cause more drowsiness, and then kids can get some excitability. I want you to discuss with your provider if you're pregnant or breastfeeding, and if you overdose, contact poison control. We've got the dose down at the bottom, so anybody over 12 is going to take 2 pills every 4 to 6 hours, and then inactive ingredients at the bottom. So now I want you to pause the video and write down some advantages and disadvantages of using over-the-counter medications. So I'll let you pause here. All right, welcome back. So some advantages of using the over-the-counter medications are they are easily accessible, that we discussed before. So say you're on a road trip, you're on a long drive, and you have a headache, you forgot some ibuprofen or acetaminophen, you can just go in the gas station and buy some. Very expensive when you buy it that way, but it is available. Some other advantages are they're convenient. So not only are they accessible, but they're convenient. If you had gone to a doctor, provider to get this condition treated, maybe you go for allergies. You've had allergies before, you have allergies now. If you go to a provider, you are going to have to schedule that appointment. You may have to wait 5 days to get in. You have to pay a copay, probably pay a bill, maybe your deductible isn't met. And then they'll call in the prescription. You go to the pharmacy, you wait for that prescription, you pay at the pharmacy, probably don't know how much you're going to pay, and then you get the medication. So that is going to take a while, and it's probably going to be more expensive than the medication you purchased over the counter. So we've got that aspect, and I think a lot of people, want it now, right? They want that medication, just want to go in and get that condition taken care of. All right. So some negative effects are, if you go into the store and say, hey, I have allergies, I'm going to get this treated, I'm just going to pick up this antihistamine and go home, that may not be the condition you're treating. So if you have a bacterial sinus infection, what do you need to treat it? antibiotics. So that's great that you're using this antihistamine, but maybe you should be getting an antibiotic. So that self-use of that over-the-counter medication could delay the treatment that you need and potentially cause that infection to be worse or to spread. So that's a big danger. Let's see. So, all right. And if you guys think of any others, that's great. So here again, this is what we discussed. You know, there's strong benefit and strong negatives to it. Another thing, these patients probably aren't going to read the label for the medication. They very well could just grab it and go, right? Maybe they're not reading that there's a contraindication with glaucoma or BPH, and then they start to wonder, hey, why am I not peeing at all? So I think that would be another negative. All right, here's a case study. I'll have you complete this and I'll have the answers posted. So a nurse is teaching a group of older patients about various over-the-counter and herbal therapies. So first, you're thinking older adult patients taking extra meds. Like, do you have any concerns there? So my concern would be polypharmacy, right? Where they're taking so many drugs and then we start to add over-the-counter medications and herbal supplements into the mix. What could happen? All right, so the first question is, one of the older adult patients asks, why do I have to be careful about how much acetaminophen I take? How will the nurse address this question? So to do this, you may need to look at your drug guide to see what some of the adverse effects of acetaminophen are. And then 2, after finishing the teaching, the nurse overhears an older man talking to his friend. The nurse hears him say, rather than taking the prescription medication for my ulcers, I am just going to take over-the-counter medications. They are much cheaper. So you may need to do a little research on your own. This person has stomach ulcers or duodenal ulcers. So what could taking over-the-counter medication do? So answer that and we'll have the answers online.